So we just heard that one of the major features of Huntington's disease is the movement disorder. And our next speaker is going to dive into this a little further. So our next speaker is going to talk about how we can study this movement and how we can use things like physical therapy to help alleviate some of the symptoms. So our next speaker was actually a professional dancer and worked with the Heidi Latsky Dance Company, where he now serves on the board of directors. He's currently pursuing his PhD at the Teachers College at Columbia, where he is also an instructor. And he does movement research in the Neurorehabilitation Lab with Dr. Lori Quinn. So put your hands together for Greg Youdan.
Thank you very much for that introduction, Stephanie. So I'm here today to talk about the benefits of exercise and physical therapy in people with Huntington's. But first of all, how many of you out there have heard that exercise is beneficial for you? Just raise your hand, right? Almost everybody has heard that exercise is really good for you. How many of you have heard that exercise is good for your brain health, not just your body? So not as many. And then how many of you are currently pursuing an exercise program or regularly exercising? Great. No, hey, I'm not judging. I'm not here to judge. But we're here to talk about the benefits of exercise. So exercise has been making the headlines recently, especially in regard to neurodegenerative diseases, such as Parkinson's, Alzheimer's, and MS. Exercise increases the blood flow to the brain, which we think may have a protective effect on the brain in these diseases. This is a study that was conducted in 2015 by a group of Italian researchers. So here you can see that on the vertical axis, we have L-DOPA, which is a drug that is used to treat Parkinson's, to treat the symptoms in Parkinson's disease. And then on the horizontal axis, you see the different time points. The graph with the circles shows the control group, and then the graph with the squares on the bottom shows the people who received an exercise training. So what we can see at the onset is that both groups have the same amount of dosage of this drug at the beginning. But as time continues in this trial, the group that did not receive exercise training actually needed to increase their dosage, whereas the group that participated had a much smaller dosage and did not increase as much. So this tells us that exercise may have the potential to delay the need for some of these pharmacological interventions. We know that medication is important, but that exercise may be an important adjunct to this. That this model of adjuncting with exercise is seen in other neurodegenerative diseases, such as Parkinson's and MS, where exercise is critical to the management of the disease. Exercise drives neuroplasticity. That just means that the brain has the power to change itself. That through exercise, we can actually improve some brain function. We were talking about brain health. So exercise can strengthen the circuitry of the brain, and it can also lead to improved motor behavior. So some of the symptoms of Huntington's disease is slowness of walking, the chorea, which we talked about, and impaired balance control. So that exercise has the potential to improve these. Robert Butler said, if exercise could be packaged into a pill, it would be the most widely prescribed and beneficial medication in the nation. But exercise is not a pill, right? It's hard to get people to exercise. This cartoon by Ed Fisher just highlights that point for me. So you can see the doctor here in the middle who's telling the patients, oh, you should exercise. So they're learning about exercise from their doctor. And then in the corner over here, small, you see the news station saying that exercise is the key, similar to those headlines that we saw in the first slide. But the patients are still saying, yes, yes. Now seriously, what can we do to improve our health? exercise is not that pill, right? We have to get people to do it, and that can be difficult. Getting to the gym is not always something that we want to do. We have this anecdotal evidence from other diseases, but what does the research say in Huntington's disease? About 15 years ago, we only had a handful of studies, and these studies were primarily case studies that focused on one participant and followed them over time. Now, more research scientists are interested in the effects of exercise, not only in Huntington's disease, but in other neurodegenerative diseases, which we saw. We are now at a point where we have over 20 intervention studies in people with Huntington's disease, but 17 were conducted between the years of 2013 and 2016. So we now see that there's this boom in what we're researching and studying for how exercise may have that neuroprotective effect. With this amount of research, we're now able to start to summarize some of those results. And that's exactly what Nora Fritz and her colleagues did. They conducted a systematic review using mixed methods. Mixed methods means that they were including quantitative and qualitative studies in their review. The quantitative studies are ones that we have measurable outcomes for, such as walking and balance. And these qualitative studies focused on the attitudes and the perceptions of not only the participants, but also their families and their caregivers. So the results of this showed that there were preliminary support for the motor benefits. So there was improved motor function, they were able to increase their walking speed, and they were able to improve their balance as a result of exercise. This group also was able to identify facilitators that would help people engage or uptake exercise and participate in more physical activity. There were personal factors. These are factors such as self-efficacy. If they know that exercise is important, they may be more motivated to participate. There were external factors. This is the identification and the commitment of the caregiver, possibly the family members as well. It's building that support team around that individual to help them and support them to engage in this new physical activity. Personalized training and structured training, setting a schedule, that helps for all of us, right? If we're doing something that we enjoy, we're much more apt to do it. And if we're setting a schedule, it may even become a habit. Lastly, that participating in exercise as a group had this social component to it that was very important to them. It gave them not only that sense of community, but that sense of support. At the Neuro Rehab Lab at Teachers College at Columbia, we're actually doing studies now to get people with Huntington's to actually engage in exercise. So one of the studies is this PACE HD study, and this is being led by Dr. Laurie Quinn and her colleague Monica Bussa, who's at Cardiff University in the UK. This study has 120 individuals with Huntington's disease. We're also still currently recruiting for this study. We're looking at physical activity and fitness through the use of wearable technology. Wearable technology such as the Fitbit and the Apple Watch allows us to track movement and to measure how much physical activity these people are having. One of the unique things about this study is that we're also including measures such as heart rate and VO2 max, which VO2 max is a measure of cardiorespiratory health, and that this allows us to start to quantify that dosage of exercise. This is through the frequency, the duration, and the intensity. One of the unique things about this study is also that it is both a natural history and a within cohort randomized control trial. So some of the participants will come in, we'll measure them and collect the data at baseline, and they'll come in 1 year later, continuing their activity as normal, and we'll just recollect the data. Other people will be randomized into this coaching study, where they'll be paired with either a physical therapist or a coach who will help them to engage in physical activity. They receive a disease-specific workbook, and then they work to create those personalized training plans and that structured schedule to support them to engage in this. We also have preactive PD. This is an exciting study. This is one of the first studies to actually prospectively look at people in the earliest stage of the disease to try to get them to uptake or increase their physical activity. And we believe that at this stage, this is the most critical. Most of the research has focused in those middle stages, but now we're trying to see if we can actually get people to start earlier. Does that actually have an effect, possibly slowing the disease? We know the benefits of exercise. We've been talking about the benefits of exercise. But exercise typically follows more of a piecemeal approach. We tend to work on one part of the body at a time. It doesn't always include the person as a whole. It doesn't really have an emotional connection to it. You can kind of just use the leg press machine and go for reps and see how many you can do. This is where dance may be a beneficial intervention. It might allow us to kind of hide that exercise pill in a very beneficial package. So dance has these other components to it. Dancers not only memorize movement, but they're also expected to time this to music. So there's more of this cognitive engagement. Also, often choreographers or teachers ask dancers to make up or improvise their own movement. So dance has these key tenets of motor learning that is already inherent to dance that we can just capitalize on. Dance has repetition through movement. There's intensity of practice. There's the use of motor imagery. All of these things are really beneficial. However, dance in and of itself is not fixing a problem. Dance is learning an art form. And this is something that I would always talk about with Heidi Latsky when I was in her company, that we were making art, not providing therapy. More research scientists now are getting interested, though, in the beneficial and therapeutic effects that dance may have. One of these researchers is Madeline Hackney at Emory University. She studies the use of social dance, specifically partner dances such as tango, and looks at their effects in Parkinson's and Alzheimer's disease. Her research has shown that dance not only has these motor benefits on walking and balance, but that it can also have an effect on cognition and on quality of life. In Huntington's disease, the research is more limited, but we have anecdotal evidence from people such as Paul Dennis, which Leora showed the video earlier. One study that we do have is using Dance Dance Revolution. Dance Dance Revolution is a video game. You have these arrows which are on the floor in front of you. So there's 4, one in front, one behind, to the right and to the left. And then those arrows will appear on the screen and you have to match your movement to the timing of the music. So the researchers in this group asked 18 participants with the middle stages of Huntington's disease to play this video game. It was for 45 minutes, twice a week, for 6 weeks. The participants not only reported that they enjoyed doing the dancing, but they also wanted to continue after the intervention finished and after the study finished. More importantly, though, they increased their score of the game, which means that there were these improvements that were happening, but they also were able to carry over these improvements into overground walking. So that we saw this transfer effect both from the video game to real life, and that was also more motivating for these people. Now, I can't stand up here and just talk about exercise without asking you guys to do a little movement yourself. I'll do that in 1 second, but I'm gonna first talk about the 4 recommendations for any exercise program. So the American College of Sports Medicine recommends that you have aerobic exercise such as cycling, running on a treadmill, or even dance. Resistance training, which can be weight training, but it can also be things such as push-ups, or we'll do some squatting or some sit to stand in a second. We'll also be doing a little bit of stretching. Yoga and Pilates are really beneficial for this. And that there's neuromotor or balance training. Tai Chi, yoga, dance all also fall within this category. So the American College of Sports Medicine recommends that you get 150 minutes of moderate exercise a week. This includes activities such as brisk walking or just riding on a bicycle. Or you can do 75 minutes of vigorous activity. This means that you're sweating and out of breath. This is the really difficult exercise. You can also do some combination of the two depending on what you enjoy. So we'll go ahead, I'll do some light stretching and we'll do some exercises now. So I'm gonna ask Stephanie to go ahead and come up and she's gonna demonstrate for me. You'll all be doing this with me, so it's not just Stephanie. So we'll start with that flexibility or that stretching component. So what I want you to do is to just take one leg forward and in front of you and pull the toes back towards your face. And then go ahead and lean forward and feel that stretch in the back of your legs. So people with Huntington's often get a lot of stiffness in their muscles, and this is one way that we can stretch and try to open that up. Go ahead and do the other side. Yeah, let that feel good, right? After sitting in that chair. Great, and then come back to seated. So we'll also work on a little bit of rotation or some trunk mobility. So I want you to go ahead and look to your right and try to see behind you. Yeah, you can use your hand on the chair and you can really try to stretch. And then do that to the other side. So people with Huntington's often end up with stiffness in the trunk and this limited range of motion. So this is one way that we can start to open that up. So now we're moving on to that resistance. So Stephanie's going to demonstrate a sit-to-stand exercise, which is one of the exercises that's included in the Enroll Registry study. So if you can go ahead and cross your arms, and then just stand all the way up. And then sit back down. So now I'm gonna ask you all to do that. So go ahead, we'll just take one practice to make sure you don't bump into anyone or knock over any drinks, and then sit back down. So I'm gonna time you, and I want you to see how many of these you can do in 30 seconds. I'm not counting, I won't be looking, but I just want you to see how many you can do. Okay. And go. You have to get all the way up, no halfway movements. Yeah, we might get a little sweaty, right? We might get our heart rate up a little bit. I want you to see how many you can do. We're about halfway there. You might be getting tired a little bit. Don't worry, the next one's easy. Great, 5 more seconds. Keep going and keep counting because this is up to you. Okay, and that was 30 seconds. So that's a nice little way to like break up your day, right? And get some movement going in there. It also will help to like build and tone those muscles. So the last ones that we'll do, we'll work on that motor, on the neuromotor and the balance exercises. So if everyone can just stand up one more time, we're not doing any more up and down though. So make sure that nothing's around you, and I just want you to pick up one leg and then just try to balance on that. If balance is something that's difficult for you, feel free to put your hand on the chair, to put your hand on the table, and just to give yourself a little bit of support. You're also in heels. Go ahead and switch to the other side. One side might be a little bit better than the other, right? But we're trying to work on that improvement of balance, right? If we practice it, we'll get better at it. Great, thank you very much. Can we now give Stephanie a round of applause for being the beautiful assistant? So just to bring it back for a second, the things that we talked about today were that exercise is beneficial, which we knew, but that exercise can also be beneficial for your brain health. And that exercise has the potential to possibly slow disease progression or even reduce the need for these pharmacological interventions. And that dance might be a great way to kind of hide that exercise pill so that people don't even realize that they're doing all of this exercise. So I just wanted to also give my thanks to Caveat and to Brainy and then to Leora and Stephanie for inviting me up here today. And then I also wanted to give a thanks to my advisor, Dr. Lori Quinn, who first introduced me to Huntington's, and without who I would not be here today. And then I also want to give thanks to Heidi Latsky, whose work you'll see a little bit later. Thank you very much.
Whew, I feel healthier already. Also, that might have been like the most workout I've done in a solid week, so oops. Gotta work on that. But those are great exercises to do at work too. Like, as long as your boss doesn't sit near you so he doesn't see you like doing your squats, it's a great way to get some exercise in work. So with that, we're gonna keep the night rolling. You're gonna have a 10-minute intermission.